Today was a good day. I want to tell you about a patient that I had. A new patient, did a consultation, and we did an exam, and this patient had some significant stomach problems and chest pains and also some upper back and neck problems. They had already had CT scans, x-rays, gastroenterologist take a look at her, the gynecologist looked at her, family medical doctor looked at her, and she'd had some visits to the emergency room. And nobody was finding out what it was. She was referred to me by her family medical doctor looking for some answers. And what we found was that the vertebra in the cervical and the upper back were misaligned to the point where things weren't moving right. Spinal dysfunction is what we're going to call that. And the x-rays showed significant rotation, and the motion palpation that we did clearly showed things weren't working right. After we did the exam, did the x-rays, and explained to her what we felt the problem was, I did a procedure called an adjustment, a specific skilled movement of the vertebra to bring things back into balance and take some pressure off of it. I got to tell you, I told her that there's three things that are going to happen after the adjustment. You're either going to feel some relief, or you're going to have some muscle pulling, or maybe some soreness or tenderness. And I said, if you're going to feel some soreness or tenderness, it's a temporary thing. Probably less than 10% gets sore, and that's true. But I also told her it's very possible that she could feel better. But again, if she felt better, it's temporary too, because the body is just not used to holding it in place, especially if she's had problems for a while. Well, I tell you, after the adjustment, this is what makes what I do so worthwhile. She said she felt 100% better. I said 100%. I said, that's a lot. And she said, well, I couldn't stand in here without pain prior to getting the x-rays. And she says, I don't have any pain at all right now. So I said, well, that's great. I said, we're going to follow up with her on a visit tomorrow, and we're going to compare and see what's going on and give her a treatment plan to teach her how she can strengthen these muscles. Let me tell you what, again, this is the kind of situation where it makes me absolutely love what I do. I mean, this is great. I can't tell whether I'm playing or working when I have situations like this, where I can help people that have had problems for a long time, and nobody seems to find the answer. And I'm not saying I'm the greatest doctor in the world, but after being in practice for 30 years as a chiropractic physician, I know what it is that I can help, and I know what I can't. And so I tell patients, if I think I can help, I'll tell you so. If I don't think I can help, I'll tell you so. So if you're having problems and you're wondering whether chiropractic can help, I don't care if you come to me or not. I mean, if you're close to me, you should. But you really should go to a chiropractic physician, preferably a member of the American Chiropractic Association, and get yourself checked out. Find out if chiropractic can help. You have nothing to lose but your pain. I'll talk to you soon.